talk about using monoclonal antibodies and how that's affected, in Mike's case, him, and then in Debbie and Alexandra's case, member of their family. We also have Senator Burgess, Mike Beltran, Jackie Toledo, and I don't think we have the other ones. And so we appreciate you guys coming. Florida has now done over 30,000 monoclonal antibody treatments using our 21 sites that we've been able to stand up over the last many weeks. And of course, those treatments are in addition to the nearly 13 million Floridians who have received the vaccine, including the overwhelming majority of people over 50 and over 90% of seniors have received at least one shot. Since we've been in Hillsborough and so we have Pasco, Hillsborough, Pinellas. We have one in Manatee. If you look at all those sites, I mean, together they're doing thousands every single day in the Tampa Bay area, and we're typically doing, a total of, or they're doing thousands a week. We're typically doing about 4,000 treatments a day statewide, a portion amongst the 21 sites. The Hillsborough is typically doing about 200 a day. We have the ability to do up to 320. Some of our sites have gotten that, like in Broward and in Brevard. Most of them are usually between 150 and 250 in terms of who's settling in. But what we're seeing is, fortunately, we're seeing admissions to hospitals for COVID decline from where they were. We're seeing the COVID hospital census decline, and we're seeing ED visits for COVID-like illness decline. So that is really what we're looking to do by providing greater knowledge and access to this type of treatment. If you get this early using a monoclonal antibody, you have a great chance to stay out of the hospital, and that's really what we're looking to do. And obviously, if you don't get admitted to the hospital, you're going to recover. So it is helping to save lives. What we saw earlier in the summer, you saw these hospital admissions going up, and a lot of these folks, well, on the one hand, you'd say probably 80 to 90% of the people admitted had not been previously vaccinated. And then over 90% of everybody, vaccinated or unvaccinated, did not get a monoclonal antibody after being infected. And so we saw that there was a lack of knowledge, that a lot of the people that were getting infected didn't even know that this was something that was an option for them. So we highlighted some of the things that were done in places like Tampa General, and this is something, the Regeneron and the Eli Lilly, but the Regeneron is what's being used against Delta. That was approved for emergency use in December of 2020. So it's been used for a while. It's been used in Florida the whole time, but it was something that required a referral from a physician, and it wasn't something that was really discussed as much as it probably should be. We also noticed as the summer was going on that the vaccines were providing good protection against severe illness, but there were a lot of people who were still getting positive tests. They call them breakthrough cases, but they really weren't as rare as we had hoped. And so there were people who were testing positive, who were fully vaccinated. And that's important because the people that are at most risk to COVID, elderly, people that have comorbidities, most of those folks have been fully vaccinated for a while now. And so you'll hear a story from the Levines about their dad who is fully vaccinated and got symptomatic COVID this summer. So we saw that and we're saying, okay, look, if you're at risk, the best thing you can do beforehand, obviously, is be vaccinated. But even if you are, and then if you're not, if you do become COVID positive, you have an opportunity to get early treatment using these monoclonal antibodies. So the Regeneron is what has been used in Florida, partially because the Lilly hasn't performed as well with the Delta variant. Now the GlaxoSmithKline is actually really strong data. It only got EUA relatively recently. The difference, though, is the GlaxoSmith is only in IV. The Regeneron can be IV or through subcutaneous, so you can come in and do 4 shots, and that actually is, you can do more volume when you do that. And then Regeneron also you can use as a prophylaxis. If you have an outbreak in like a nursing home, you can actually give it to people who have not necessarily tested positive, but may be high risk and may be exposed. Also, the Regeneron was purchased by the federal government, so when that's coming down to states and it's going to our clinic, that's coming at no cost to the state of Florida, and importantly, no cost to the patient. And so there's some folks that act like this is costing you thousands of dollars. That's misinformation, and I would hate for that misinformation to deter somebody from getting treatment that could actually help them and get them back on the mend and keep them out of the hospital. And so now the GlaxoSmithKline, as that becomes more available in kind of the normal medical marketplace, I think you'll see that being utilized more in Florida. I think most patients can get it. If you look at the different rebates that are offered, we're trying to figure out what that would look like. But clearly for now, we have an effective option, and patients can come in and they're not going to be charged to be able to do it. So we have 21 sites. Obviously, we have a good footprint in the Tampa Bay area, strong footprint really throughout the state. We tried to say, let's try to get it to where you look at our major population centers, can people have a reasonable way to be able to access one of these? And I think we've been able to do it. But it's important to point out, this is not the only way to get it. This has been offered in hospitals and health systems since December of 2020. Actually, Tampa General, they were doing some of the experimental trials of Regeneron even prior to the EUA. So this is something that's available. So you may want to look and see what's in your neighborhood if one of these sites isn't as convenient as you like. If you want to look at our treatment locations, you can go to floridahealthcovid19.gov. And then if you want to register, you can actually do an appointment beforehand. You go to patientportalfl.com. It had been, prior to us doing these sites, you would need to be referred from a physician in order to be able to go to, say, one of these infusion centers. We have done with the Surgeon General a standing order, and so you don't necessarily have to be referred from a physician. We're not saying don't talk to your physician. Obviously, I think that's a smart thing to do. But you don't have to necessarily get a piece of paper signed. So if you come in and if you fit the EUA criteria, you're going to be able to be treated. And really, these treatments are most beneficial for people that are at high risk of severe illness from COVID. So of course, people who are older, people that have diabetes, people who are overweight, have kidney problems, immunosuppressed, cardiovascular, or lung conditions. And so if you get COVID positive and you go in early, this has a great chance of resolving your symptoms short of needing to be hospitalized. And so we've been doing this. People have had good results. They've been talking. More people ask about it, and then it kind of builds where more people will then seek it, which is great. So we have some folks here who are going to talk about it, and I think that these are really positive stories. And so one of the stories is actually from our Lieutenant Governor's family. So she's got to come up here and talk about her mother.
Well, good afternoon. Thank you, Governor, and thank you to all of you that are here today. We are really proud of our administration's work, both on our vaccine deployment across the state, making sure that we prioritize seniors first. That was something that the governor took a bold approach in doing, and you've heard the numbers of our seniors being vaccinated. But as we know now, that vaccination doesn't necessarily prevent all COVID infections. So the governor has also gone around throughout the entirety of the state highlighting the importance of these monoclonal antibodies. What we're seeing is that these monoclonal antibodies are preventing severe illness, they're reducing hospitalization, and quite frankly, they're saving lives. And as the governor mentioned, just recently, my 82-year-old aunt and my 85-year-old mother, both fully vaccinated, tested positive for COVID-19. My aunt has significant health issues, and so the doctor told me, do not wait, make sure she gets this treatment right away. And then shortly after, my mother tested positive, and so both of them, I saw how quickly they recovered and how we were able to stave off significant symptoms, hospitalizations, and again, for many individuals, this is a life-saving treatment. So we are proud of the work that our administration has been doing to make sure that Floridians throughout our state have access to this incredible treatment. We're proud that we have now 21 sites. If I knew the governor, I would tell you we're not stopping there. We're going to make sure that everyone has access to this, and I think it's an important event today to make sure that we highlight the importance of education and awareness. And I think our legislators that are here are doing a great job touting it in their districts and their communities. But we understand that we have certain tools at our disposal. Number one, obviously the vaccinations. Number two, monoclonal antibodies. So we really urge Floridians to take note of the sites that are located close to them to make sure that they utilize this, because in the end, I've seen it firsthand. I think you're going to hear some really powerful stories of others that have seen it firsthand. This is indeed a game changer. So thank you, Governor.